The Health Minister has said that his government had taken utmost care to prevent the spread of dengue and swine flu cases in the state, even though such cases were mostly detected among migrants who live and work here.
In the past few months, there was a drop in malaria cases, especially in Bardez Taluka, but the rise in dengue cases in the Taluka during the same has raised concerns. Efforts including anti-larval measures and educational programs undertaken by the Directorate of Health Services have succeeded in bringing down the malaria cases to a low, but the number of dengue cases have risen up to a certain extent. Speaking to media reporters, Health Minister Francis D'Souza said that the state government had taken every precaution, but somehow migrants come with swine flu and dengue infections and spread it in the state.
See, we try to sanitize the whole place, but somehow people from outside, migrant come, bring swine flu inside, and it spreads. When there's a dry spell, mosquitoes breed fast. When there's a long wet spell, mosquitoes don't breed. So in dengue, mosquito breeds in clean water.
Okay.
So public awareness also has to be there for that purpose.
No, but your government is fully geared.
Yeah, fully geared. But exceptional cases will happen.
But what about the medicines?
Because what happens is people detect it late.
Okay.
They get late treatment. All these are factors. And dengue combined with other sicknesses, that is also a factor.
Kalangut MLA Michael Lobo said all officials of the State Health Department should ensure that anti-mosquito spraying and fogging was done at places where water has stagnated.
And all health officers, not only in Kandolim, entire Goa, in these days, especially in this month, that is in August and September, these are the 2 months where dengue and malaria cases go up, because it rains heavily, then hot sun comes and the water gets stagnated over there when there is no flow of the water, and in that larva forms. So this is where the spraying has to take place. So the fog machines and spraying machines have to be on in these 2 months. So all the health officers have to take care of this.
Mr. Lobo stated that dengue cases were still on in his constituency, and therefore there was a need to take care of any stagnant water taking place in the vicinity.
Like near Bossia Hospital, there is a paddy field where a lot of water has got stagnant, and today I have sent assistant engineer and junior engineer of PWD that the 2 cross drains which are there are blocked, totally blocked. So water is not flowing into the Nalla on the other side. There is a Nalla. So this water has to go into the river, so which is not going. The water is stagnant. So there is it is likely that dengue cases can spread over there. So we have to see that this water flows from this paddy field to the Nalla. So for that the work has started. Even from the health center, they have to go on spraying wherever there are dengue or larvae being formed in small gutters, especially when there are choked gutters where people leave their wastewater into these gutters. So there